Hi, we are going to inject orthosamid injection into this patient. Before that, I'm going to see if she has got any fluid in her suprapatellar pouch. On the screen, you can see she has got fluid in her suprapatellar pouch. So the first step will be to aspirate that fluid. Now, to keep the patient pain-free, I'm going to inject local anesthetic first into the soft tissues, and then I'll be approaching towards the suprapatellar pouch, and you can see my needle is approaching toward the suprapatellar pouch. So the purpose of injecting local anesthetic is to keep the patient pain-free during all this procedure. You can see my needle has approached the suprapatellar pouch. You can see the needle moving backward and forward, and you can see the local anesthetic dropping into the suprapatellar pouch. So after putting the local anesthetic, I'm going to aspirate this synovial fluid. So normally synovial fluid is formed inside the knee joint for lubrication, but when this knee joint lining become inflamed, it starts producing more fluid. So to give this patient relief, I'm going to aspirate this fluid, extra fluid, and you can see my needle is doing that job. It's aspirating the extra amount of synovial fluid from the suprapatellar pouch. So you can see my needle, which is very nicely placed in the suprapatellar pouch, and this is the most important step in this injection, that when you inject orthosamid, you inject it into the right place. So now you can see I've aspirated about 20 mils of synovial fluid, which was formed by the inflamed synovium. And you can see my needle is still in the suprapatellar pouch, and now I'm going to inject some more local anesthetic because I'm going to inject after that orthosamid. So the idea is this, that putting local anesthetic, that she doesn't feel pain while I'm injecting orthosamid injection. So now you can see my needle is in the suprapatellar pouch, and the fluid is dropping into the suprapatellar pouch, which we have already aspirated before. And now I will be injecting orthosamid injection, and you can see that orthosamid injection will be flowing very nicely and smoothly into the suprapatellar pouch, as you can see in the screen. So it's flowing very nicely, so I'm very happy that it is going where it should be. So the procedure is going very well. Patient is comfortable. So you can see that our aspirated 20 ml of synovial fluid, and I've injected orthosamid into this patient's joint, and she didn't feel any pain, and she is fine, and hopefully within 6 to 8 weeks time she will start feeling better.